There you go. Hi, we are here to present our cultural considerations and behavior analysis and assessment poster. The purpose of our presentation is to provide current resources for school psychologists and other mental health professionals in regards to supporting culturally and linguistically diverse students. You should learn how to determine, or this will help you determine how educators and school districts can strengthen their identification process and better serve diverse learners. And we're also introducing an infographic. It's just a simple tool to help you in the formulation of culturally attuned behavioral analysis. It'll direct you to evidence-based resources, provide some helpful questions, and provides a quick overview of basic information regarding the importance of using culturally attuned functional behavioral assessments and behavior intervention plans. And there's also a folder that will provide even more resources for you. It's important to take into consideration cultural variables when assessing the relationship between a child and their environment. And there are multiple benefits to taking that into consideration, as you can see here.
There are key definitions that one needs to be familiar with in order to better understand and plan for effective interventions for culturally and linguistically diverse students. These terms include culture, race, and ethnicity. A deeper understanding of these terms and definitions can help school psychologists to determine if the assessments they are using are appropriate for the students they are serving. The Cultural Formulation Interview, or CFI, is a brief semi-structured interview for systematically assessing cultural factors that should be considered during diagnostic assessment. This tool can be used during a mental health assessment to help determine the impact of culture on key aspects of an individual's clinical presentation and care. The integration of the CFI with other clinical knowledge and assessments can aid in a more complete and valid clinical diagnosis and also facilitate treatment planning. Taking into account the cultural context of the individual can also increase the engagement of the client in the treatment plan. The inclusion of a cultural assessment when diagnosing mental health problems is critical. This easy-to-use interview, when used in conjunction with other tools, can enhance the validity of a diagnosis and support treatment planning.
It's important to ask questions and make observations considering where the child is in the acculturation process. The extent to which a child departs or maintains their cultural practices of origin will give rich insight as to what stressors they may be facing. What may seem like a challenging behavior at first may be attributed to which stage of acculturation the child is in. The acculturation process is not linear, meaning that a child could swing between these stages. Stressors that are associated with acculturation are pertinent to consider. For example, if the child is the sole translator for the family, is the anxiety that you might be seeing in an FBA or an assessment manifesting itself in maladaptivity, or is it due to just acculturation alone? So consider asking yourself, can the behavior that the child is exhibiting be explained by acculturation alone, or does this child need time to adapt to the culture, and is it truly time to intervene?
There are 4 principles of cultural responsiveness that should be considered in regards to assessments and intervention models. Cultural validity includes considering instrumental validity, or whether the assessment measures what it is intended to measure. Cultural relevance and validation include adapting and modifying to reflect experiences, languages, and values so that interventions are appropriate. Cultural self-knowledge and awareness involve reflecting on one's own multiple identities and implicit biases that one holds and consider how they may impact these evaluations and decisions. Self-knowledge should also include continuing to educate oneself about the communities they serve and the policies that may impact them. The last principle is cultural equity, which means committing to developing culturally equitable discipline outcomes. Other considerations in regards to the intervention process are listed above.
Thank you for taking the time to listen to our poster presentation. The QR link at the top of the poster will take you to our infographic that just provides a refresher for school psychologists and maybe could be used for a quick PD. And I just want to say thank you to SlidesGo and FreePick for the template and images on our poster. Thanks.